Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Welcome back to this week's episode of The Feds. I am Stephanie Weidel. Go ahead and like, comment, subscribe to, and share our podcasts. We can't grow without your support. Thank you to everyone who listens on a regular basis and forwards our content. If you haven't heard yet, Feds for Freedom, Virginia Medical Freedom Alliance, and Liberty University are teaming up to spread the word about medical freedom, government overreach, and the importance of the Constitution. This is a one-day event at Liberty University on Saturday, April 5th. There's a fantastic lineup of speakers, all coming from different angles of the freedom movement. If you are on the East Coast, please consider traveling for the weekend to Lynchburg, Virginia, and joining us. Students are free but need to sign up. Please register for this event at vampa.org or on our website, fedsforfreedom.org. This week, we have the pleasure of speaking with Dr. Mary Bowden, a Houston-based ear, nose, and throat physician who blew the whistle on the Texas medical system's censorship of doctors with medical opinions contrary to their own. Her medical license was almost pulled, and her whole life has changed within the past 4 years for being so outspoken. She is the president of Americans for Health Freedom. Thank you, Mary, for all of your work. It is a pleasure to meet you. Welcome to the show.
It's great to be here. Thanks for having me, Stephanie.
Mary, you have gained national attention since you were targeted by the Houston Methodist Hospital for speaking your own medical opinion and about the COVID-19 shots, and also about the use of ivermectin. That's when the whole nation saw you at that press conference and where I first saw you. Would you give us a brief timeline of events the past couple years, ending with your court case that just happened in January of 2025?
Yes, I'm a ear, nose, and throat doctor in Houston, Texas. And when the pandemic hit, I opened my doors to sick people. So, as a ear, nose, and throat doctor, I'm very accustomed to seeing patients with respiratory illness. So, I've used common sense at first. Breathing treatments and steroids and antibiotics, and briefly used hydroxychloroquine. But when President Trump came out and said it was, going to cure COVID, the Texas State Board of Pharmacy actually shut it down. They prohibited us from using it. So I put hydroxychloroquine on the back burner. I did not have ivermectin on my radar early on. Started using monoclonal antibodies, and those worked wonderfully. Initially, I could get as many doses as I wanted directly from the manufacturer. They'd be in my office the next day, and I never rationed them or restricted them based on, comorbidities or race, as some people were. So I became known in town as the place to go get monoclonal antibodies without a lot of red tape. And my practice exploded. And I was also testing people for COVID. And so when Houston Methodist started, they were the first in the country to mandate the COVID shots. And I had privileges there, but I was very loosely affiliated with them. I'd actually never stepped foot in that hospital. I was collaborating with them on research, though, because I was seeing so much in my clinic. I mean, basically, all my clinic, my ear, nose, and throat clinic became a COVID clinic. And I was just collecting data, and I was sharing that with them, and we were going to publish it. And so what quickly realized, and this was the fall of 2021, and this was during the third and the largest surge of the pandemic, what I saw was these shots weren't working. So the vaccinated outnumbered the unvaccinated and were just as sick, if not sicker. I brought this to their attention, and they dismissed me. They just said, well, we think the shot's lower severity. So then I started speaking out on social media. And at the time, I really didn't have very many followers, and I was much more careful about what I said back then than I am now. I said simply vaccine mandates are wrong and ivermectin works, things like that. And But one day I decided to tweet out 25 times, vaccine mandates are wrong. And then I put a screenshot of emails or responses I'd gotten from patients regarding these mandates and how it was affecting their lives. And that was sort of the final straw with Methodists. And they went after me a few days later. And that's when I got a text message from a reporter at the Houston Chronicle saying, can you please confirm that your privileges have been suspended from Houston Methodist Hospital? And I did a double take and I said, no, I don't know what you're talking about. Check your source. I go to my email and there's a suspension notice in my email. And then I go to Twitter and they posted a thread about me spreading dangerous misinformation, harmful to the community. And so, I had to choose what to do, retreat or attack. And I counterattacked. I felt like I'd been punched in the face. And I just wasn't going to retreat after that move. And I sued them. I sued them twice. I tried to get their financial information because as a nonprofit, they are required to disclose their finances upon request, and they just ignored my request repeatedly. Unfortunately, I lost that lawsuit. And then I also sued them for defamation, and I lost that lawsuit. So, it's the courts. Unfortunately, I know obviously we don't think it was fair decisions from the judges, um, but it's the mafia. I call it the medical mafia. Houston is home to the largest medical center in the world, the Texas Medical Center, and it really dominates our economy. And they have a lot of influence on our political system as well. So, but I sued the FDA and I won that lawsuit, and that was
And what did you sue him for?
that was over their misinformation that they spread on their website and on social media. So it's interesting. It was an orchestrated attack. It was tied up with trying to combat vaccine hesitancy. When you look at the sequence of events, so in mid March of 2021, the FDA posted on their website a page about ivermectin and how you should not take ivermectin to treat COVID, and doctors should not prescribe ivermectin to take COVID. I mean, to treat COVID, and that is not what they're allowed to do. So, their role is to approve drugs for human use and then move on. They're not supposed to tell patients what they should take for certain diseases, and they're not supposed to tell doctors how to treat certain diseases. But they overstepped those boundaries, and so we sued them. They also let me go back to that timeline. That was mid March, uh, and then at that same time, Biden doled out $11.5 billion to different organizations around the country um, to promote or to fight vaccine hesitancy. So they sent it out to church groups, sports leaders, local community leaders. In the web is too complicated to trace because there were so many groups. It went from 275 to over 17,000. They called it the COVID-19 Community Corps. So this launched on April 1st, 2021, which was the exact same day that Houston Methodist declared it would become the first hospital in the country to mandate the shot. Not a coincidence, in my opinion. And then, we've got this summer surge of cases, which is following the rollout of these COVID shots, which clearly are not working and not doing what they were promised to do and prevent transmission or lower severity. Then in late August of 2021, the FDA launched the horse tweet. And so that is that famous image of the attractive healthcare worker nuzzling the horse. And you don't really need the caption, but it says, seriously, well, you're not a horse, you're not a cow, stop it. Well, they said it was just a quip, it was meaningless. Well, it had dire consequences. Um, it resulted in pharmacists refusing to dispense it. So we'd send them prescriptions. And even to this day, I still can't send prescriptions for ivermectin to a regular pharmacy. CVS and Walgreens are still refusing to fill these prescriptions. Um, but right after this first tweet was Biden mandated the shots for federal employees, and they took away monoclonal antibodies. So it was all tied in together. And we sued them and we won, and they had to take down their misinformation.
Mm. You're very, very on top of it when it comes to looking at other states and the legislation, not only legislation, but also litigation going on. Do you know of any litigation happening against those pharmacies like CVS, Walgreens, regarding their refusal to actually fill these prescriptions?
Yeah, I know one person did try to sue. I believe it was Walmart that they tried to sue, and unfortunately, they lost that lawsuit. It was a patient who was denied ivermectin, and it created a delay in treatment and had some medical consequences because of that delay. And it's really sad because what I've told these pharmacists is, okay, you're denying this prescription, but I have ultimate responsibility for this patient. You're deciding what this patient can take and what they can't take, but you're not there if the patient gets worse, right? You haven't had private conversation with this patient, and yet you're determining what this patient can take. It's truly unbelievable.
I remember the summer of 2021, I had a running prescription of ivermectin. I was given a 5-day supply and it was about $10.
Oh, wow.
By the end of that summer, it was about $100 for a 5-day supply. And then one day I walked into the pharmacy. This was a Harris Teeter, not my regular one. And they said, "We have been told not to fill ivermectin prescriptions." And I said, "Why? What just happened? I just got some, last month somewhere else." And they said, "We have been told not to fill ivermectin prescriptions for COVID." And I said, "Excuse me, how do you know this is for COVID?
Mhm.
That's not your business.
Well,
This could be for Lyme disease."
yeah, and that's a new thing now. Pharmacists are demanding diagnoses when we prescribe
Yeah.
patients. I've never had that happen before. And now they say, well, insurance won't pay for it without the diagnosis, which is crazy. I mean, that's totally handcuffed doctors that we're not allowed to use off label prescriptions.
Whoa, so they're requiring a diagnosis for just anything.
Not well, it's hit or miss, but more and more. It's a growing trend. And so, for example, I prescribed an inhaler for somebody and they wanted to know the diagnosis which I've never had that happen before. So
But doesn't that
I'm
break some
on ivermectin.
rules?
Well, it handcuffs doctors and it creates delays in treatment. It creates hassles for patients. It creates more costs because if you don't give the right diagnostic code, they can just refuse to pay, which and then the patient has to call the doctor's office, try to get that all sorted out. It definitely impacts patient care.
Hmm. Well, how have you changed your own practice of medicine um, in light of the COVID presence, like the COVID response?
Yeah, I have learned a lot. It's been very impactful, not just personally, but professionally. There's this dogma that you cannot treat a virus, and that I think that led to this horrible outcome that we had during COVID. Is that you just have to let a virus run its course, and there's nothing you can do. That's pounded into us during our training because they don't want people throwing antibiotics at viruses and then creating antibiotic resistance. That's sort of the premise of that we need to be conservative about treating upper respiratory tract infections. But what we learned during COVID is that's not true. There are things you can do early on. And I treated over 6,000 COVID patients, and everybody that got early treatment survived. I even had people in the later stages come into my office with just, really super sick. That's another thing I learned is you don't treat somebody based on their O2 sat level. So I had a guy come in with an oxygen saturation of 66%. And he had had a history of throat cancer. He had a prior heart attack. He was not a healthy guy, right? So this And, prior to COVID, I would have called the ambulance and had him whisked off to the emergency room immediately. But he came to me because he purposely did not want to go to the hospital because he knew what was going to happen. And I had to give him the choice to die in my office, which was very scary. But I learned a lot from this case because we saved him and we brought him in every day. We sent him home with oxygen. We gave him IV steroids. We gave him high dose ivermectin. We gave him high dose vitamin C. We gave him breathing treatments, and he pulled through. And I had a handful of patients like that. He wasn't the only one, but it was very gratifying, and it taught me that you just don't put somebody on a ventilator based on their oxygen saturation level, and that people can tolerate much lower oxygen saturations than we realize.
Hmm. It's incredible. So, how have you structured your own practice to kind of get out of the corporate controlled care model that we see throughout the country now?
Yeah, so when I finished residency, I joined a traditional ENT practice where we took, insurance, we took Medicare, and I was very frustrated by the stranglehold that these third parties had on patient care. Like one easy example is ENTs, we do an endoscopic examination of the nose. It's very routine. It takes about 10 minutes. It is an extra fee. So it's an extra code that we put. And I would never know, okay, if I do this exam, is the patient going to get some huge bill because insurance won't cover it? And it always stressed me out because I'm like, this is a very routine part of my physical exam. It's important. It's easy. Um, it does take time, so you want to get paid for it, but the patient shouldn't get some big bill if they choose not to cover it. So that always bothered me, and just always having to clear everything with the insurance company before you could do anything. So I ended up having 4 boys in 5 years, and I quit practicing, and I wasn't even sure I was gonna go back. But, as the boys got older, I decided, yeah, I'll give it another go, but I'm gonna do it on my terms. So I'm not gonna have any third parties telling me what to do. So I started, it's called direct specialty care. So it's basically you pay for each visit, and all the prices are on the website, and you know exactly what everything costs. And I don't contract with insurance companies, and I don't contract with hospitals, and I don't contract with the government. And the only people I work for are my patients. And that was very fortuitous during the pandemic because of being so independent. It allowed me to help people the way I saw fit, and I wasn't answering to a third party.
Why do you think so few physicians go that direction of that model?
Well, it's financially risky, and I would probably make a lot more money if I did take insurance, to be honest. It's much safer and easier to become an employee and just go about your business, do what you need to do for medicine, and not worry about the economics or, there's a lot of time that goes into running a practice, right? I got employees and taxes and all sorts of things. Whereas if you're an employee, you can just practice medicine and not have to worry about any of that, which is very it's freeing in some ways. But then what we saw during the pandemic is you've got to answer to third parties, which is also very frustrating.
Do you think more and more physicians will go this direction now? Do you think COVID has changed enough physicians' minds or um,
Yes and no.
integrity? Can you say that?
Yeah.
So that they'll go this model?
Yeah, I think they purposely attacked me to set an example to show other doctors, okay, this is what's going to happen if you go against the narrative and go against the government. Um, yeah, and unfortunately, I think so. Doctors tend to be rule followers. You kind of have to be a rule follower to get through school, get through your training. You don't have a lot of people that naturally are buck the system, or they wouldn't make it through training. I mean, that's just sad but true. So I think they're naturally cautious and less likely to be independent. And it's just I think the last number I saw, 77% of doctors were employed. I wouldn't be surprised if it was higher than that now. just because it's just much more secure, and that's more appealing, I think, to most people. And I think the way that um, the doctors are trained now is a lot different than the way I was trained 20 years ago. And the compliant are even more rewarded than they once were.
Yeah. So how do we get out of that? Is the root of it really in the schools, the medical schools?
Yeah, I definitely think it starts in the training and the schools and the people that they allow into the schools. When I don't know if you saw that interview with the surgeon in Tucker Carlson recently about DEI
Yes.
dominating our medical
Yes.
education. Getting rid of that would be a step in the right direction, but it's not going to be an overnight fix. It's going to
Yeah.
be a generational shift.
If our audience has not listened to that interview, they should go listen to it. It was downright scary. I mean, Tucker Carlson made the point. This is the ultimate. You expect the person to know what they're doing because your life is in their hands. And if they have not gone through the correct training, if they've just been let off the hook because they're a particular skin color or a particular sex, then I mean, that is the ultimate unethical thing.
And I will say, I mean, you see people squeeze through the system. Even 20 years ago when I was in residency, the chair of my department, I wouldn't have let him operate on my dog. I mean, there are definitely people that get through the system that shouldn't. I mean, now he had other good qualities. He was very creative and he invented a surgical uh, tool that we still use. And he did a lot of research, but yeah, there are people that should not be operating that get through the system. And so I tell people, yeah, I think anesthesiologists are a great source. Like if you're trying to figure out, you know, who to go to for a surgeon, if you know an anesthesiologist, that's a great person to ask. Or if you know somebody like a scrub tech in the operating room or an operating room nurse, I've heard, the orthopedists, if you talk to the people that do the rehab for these patients and they see the outcomes, but it's very hard to tell, if you have a good surgeon or not without a little bit of inside information.
What else can people do to kind of like protect their health when it comes to like surgery?
Well, what's interesting, 20 years ago, we didn't have the internet. We didn't have all the information that we had on the internet. And it was a totally different type of interaction with patients back then because they were coming at you pretty uninformed for the most part, other than like talking to other patients. And now, I mean, you can get all sorts of information from the internet. And I think there's been doctors don't like that, but it is the new reality. It is so I look at it as I learn from my patients because I don't have time to do if you've got a medical problem, most people, especially if it's a serious one, you're gonna do your own research. And, yeah, I have learned things from my patients. I look at it as, you have something that you found you want me to dig into, I will do it. If you go to a doctor with your research and your doctor scoffs at you or dismisses you, that is a red flag.
Let's talk about the politician and medical system relationship. You touched on this earlier. The past 4 years have exposed the incredibly tight relationship of these politicians and the medical system, whether it be big pharma, doctors. We saw firsthand the danger of this relationship. So, how have you personally experienced this even recently? And how can it be broken?
Yeah, so when I gave that press conference, one of the things I said was politics has no business in healthcare. I felt very strongly about that. When COVID was surging at the beginning, before I became infamous, I went on a radio show, the Michael Berry Show, and he's in Houston, but he's nationally syndicated. And I remember being very worried because I was like, I don't want this to seem political. I don't want to go on this show and people think, well, I'm motivated by the politics. And I actually hated politics before all this. Like I purposely avoided it and, really thought it was too divided, and anyway, so here we are. And now I have a nonprofit where I am supporting politicians who will say that the COVID shot should be pulled off the market because I just don't see any other way at this point, other than to get involved and other than to fight because it is what it is. It shouldn't be what it is, but the sad reality is that we have politicians determining our healthcare, and so our only choice is to fight back.
So, how can we as average American citizens make sure that politics are not in the exam room with us?
Yeah. Well, finding independent doctors. I mean, I've had patients tell me they go to see their doctor and the doctor starts ranting about Trump. I mean, that's crazy. Um, and, I'll have patients bring up politics and I'll talk about it. But if your doctor is talking politics without any kind of prompting, that's a huge red flag. But, finding doctors that are not financially dependent on the system, who are truly working for their patients. There is a growing movement called direct primary care, which is like affordable concierge care. You pay a monthly fee, and the fee is usually typical like a gym membership, so it's not exorbitant. And you are given unlimited time with your doctor for whatever comes up. Now, they're not always like-minded with COVID. In fact, one doctor I've mentored to turned on me and tried to get my license revoked, who was a direct primary care doctor in Houston. But for the most part, I mean, that's a starting point. If you can find a direct primary care doctor, yeah, what a good way to think about insurance is kind of like with your car insurance. You don't use your insurance to get the oil change. You use your insurance, you get a car wreck, right? So, same thing with health insurance. Use have a backup in case something catastrophic happens. But for your routine everyday problems, get plugged in with a direct primary care doctor, and then, the best way to stay healthy is just take care of yourself. Like, don't, eat healthy and don't gain weight and get enough sleep and manage your stress so you don't need to go to the doctor.
That's a really good point. And this kind of gets into what also you've been talking about on social media with your own carnivore diet. So, how does that work? Like, how does weight loss actually happen with just eating meat all day?
That's why I love it because it turned my views 180 degrees. I remember I had people telling me about it, and I thought, well, that's crazy. Um, And then I went to my OBGYN to discuss something I had going on, and he suggested a tummy tuck, and I was horrified. So I was like, "Well, I'm trying to carnivore
How
before I go that."
insulting.
Well, yeah, but whatever. We're friends. It was kind of it wasn't, um
This is a guy physician suggesting this?
yeah, we are friends. I mean, I'm not mad at him for it. It was good. It jump started me 'cause, okay, well, before we do that, we're gonna try carnivore. And,
Mm.
it's crazy because you're, like, snacking on bacon and the weight just falls off. And you're not hungry. I mean, you're bored. It's a little bit boring, and the first month is, an adjustment because you have intense sugar cravings. But once you get over that, it's so gratifying because you're not counting calories. It is very simple, so you don't have to really think about it much. You do have to sort of prepare, like, I don't do it anymore, but I was bringing bacon to work every day. Um, so you're gonna have to have things ready if you hungry. But it's my insulin level is point 0.2, which is unheard of, and my cholesterol is fine. It's a little, low 200s, but it's always been that way. And I weigh what I weighed in high school. And it's crazy. I mean, so um, it. I tell 'em I mean, probably once a day, I'm telling a patient to try it because it's much safer than, Ozempic or either their, injectable, weight loss drugs and cheaper.
Right. So your you have a nonprofit, correct? The Americans for Health Freedom, where you support politicians who are interested in banning mRNA.
Right.
So tell us about that and who these politicians are. Are they federal government? Are they state?
It's a mix, but it started because I saw a state representative from Michigan, Brad Paquette, post something on X about he had myocarditis after the shots, and he's young, he's in his 30s as a baby. And so I reached out to him. I said, "Would you just be willing to state that the COVID shot should be pulled off the market?" And he wholeheartedly said yes, and sort of gave me the confidence to start asking more politicians. So I started the nonprofit to, just grow this movement. And we have 240 elected officials now who are willing to say, all they have to say is, yes, the COVID shot should be pulled off the market. And it's a mixture of power positions. So we have school board reps, we have precinct chairs, we have state reps, state senators. On a federal level, we have Thomas Massey, Marjorie Taylor Greene, Lon Johnson. Um, we have we have state representative parties. We have and then we have positions that can sign too. So we have I haven't counted in a while, but last I counted was 17,000 positions. We have medical groups that have signed on, the AAPS, the Independent Medical Alliance, um, the React 19. There's a variety of groups have signed on too. Um, and then more recently, and a lot of those candidates, we are supporting candidates too. A lot of those candidates ended up in office, especially in Texas. We saw a lot of those candidates get in office. Now, Texas, one of the candidates that we supported, Wes Virdell, has now drafted a bill to ban mRNA shots in Texas. So that's our goal, is to get them into office, support them in office, and then get them to draft bills that ban the mRNA
Yes.
shots.
Yes. And we as Vets for Freedom, some of our members have drafted a bill talking about banning mRNA, the entire platform. Um, and we're certainly seeking a sponsor. So maybe we can team up on that
Yeah,
at the federal level. But talking about banning mRNA, it I as a Feds for Freedom, so we're talking about freedom here. Where is the line? Because mRNA, shouldn't it be left up to the person to decide if they want that or not? This is something to discuss.
under normal circumstances, yes. But this product was rushed to the market. There's fraudulent data, and I'm not sure if you're familiar with Brooke Jackson. I actually interviewed her for my podcast. She saw all these issues going on with the way the trials were being conducted. So we can't even rely on the data they presented. And what we've seen is that data, you can manipulate it to serve your purpose, which is what Pfizer did. And so the whole, it was rushed to the market. The data is not reliable. And then we have so many injuries. I mean, I looked at the new patients that came to my office in the first 2 years following the rollout of these shots. 7% were coming to see me for injuries directly related to these shots. I've never seen anything like it with any other product on the market. Any other product would have been pulled a long time ago. And, at this point, sure, adults, if you want to go get that, fine. But children, I mean, 9 million children in America have gotten the latest version, the 2024-25 version of the shot. 9 million children have gotten this. And it's frightening because if you get myocarditis as a child before you speak, parents have no idea. So they may have a fussy child, but child can't say, I have chest pain. So myocarditis can leave a scar on the heart, which then can manifest years later. They're running down the soccer field and they have a cardiac event. That's what I'm scared of. And then the potential for these genetic alterations and messing with the genes, especially in a child, where the cells are rapidly dividing and then you go in and tamper with that, it could just have catastrophic consequences. Uh, so that's, I don't feel like you should have a choice with something that's harmful. And there's the risk. It's all risk, and there's no benefit.
Hmm. Yeah, you mentioned Pfizer. This is where it gets into the political realm because when I think of medicine and the shots, it should never have been political. It was made political, and I'd say I have become less political looking at this because I saw on both sides of the aisle they were saying the exact same thing. So, and that's scary. But you mentioned Pfizer and not providing good data. I mean, providing fraudulent data. What are your thoughts about Albert Bourla actually being praised in the White House as of like a week and a half ago?
Yeah, it's very frustrating. And the other concern I have is you can't really speak out against Trump now. You get pummeled for doing that. And so when he does something like that, we should all be calling him out, right? And people are scared to, because of, you get the pushback from all of his fans. And, I think I'd much rather have Trump in office. I voted for Trump. Well, yes, scared to call him out over, he's going to make mistakes. He's human, right? I don't know that there's a single president in history that has a flawless record. But it's concerning that if you say anything negative about Trump, I mean, I had people swearing at me because I made a little comment on X the other night, and I'm following you, I'm blocking you, and using all sorts of curse words at me, um, because I threw a little shade on Trump. We can't have
This whole issue is not political.
right.
I do not understand why people see the divide and think that we're against a president because we're against this technology. I mean, that's not the case.
Exactly.
But all he has to do is open his mind to see, well, maybe what I have put my trust in here, maybe I've not been given good information. And Trump certainly knows that from his first term. He wasn't given good information.
There's all sorts
His own people turned on him.
Yeah, there's all sorts of ways he could frame it so that he doesn't, take the full brunt of the blame, right? And I think it would be so refreshing to have him admit that it was a mistake. I mean, I think it would gain him a lot more respect. I mean, I think it would help him if anything.
Well, you know what? He doesn't even have to say it was a mistake. Just say, you know, this actually might be harmful. That's all he has to say.
Right. Right. Exactly. Kind of like do you see what Casey DeSantis said yesterday about
Yes.
it? That was
Remind us.
she said that it was unconscionable that we're giving these children these shots. And, it's not even that we can prove they're harmful. So we don't even know for sure. So why are we experimenting on them? Why, it's still considered experimental. And it's under emergency. These shots are under EUA, or emergency use authorization, for kids under 12. And they're on the pediatric vaccine schedule. So all babies are expected to get 3 shots by the time they're 9 months old.
It's absolutely heart-wrenching. Um, well, informed consent. It seems that RFK Jr., it seems that he wants to make informed consent at the heart of his HHS. Um, true for freedom of choice, true informed consent should be there. But to your point, we have not been given information or the ability to refuse. I mean, we saw that with the COVID mandates. I mean, it's jab or job. We were given that choice. Um, so where do you think RFK should go with this? And what are you seeing right now?
Well, we keep hearing radical transparency. That's sort of the slogan they're using. And I thought his op-ed on measles was disappointing in that regard. I think there could have been a lot more transparency shared, a lot more information shared, because now what we have is a lot of rumors flying around. Rumors that the child received the vaccine when the child was sick, rumors that the child denied breathing treatments that could have saved the child's life. And though, if you looked at what the data on who was vaccinated during this outbreak and who wasn't, it's muddy. So 62 of the, I don't know what we're up to, maybe 150 something cases. So, more than a third of the cases, they don't know the vaccination status. That's kind of odd. Um, it suggests to me that they were vaccinated, but they didn't have a card to prove it. So they said unknown, which seems to not, the spirit of radical transparency. The more information, the better, and that's the spirit of informed consent, right? And now what we're getting is propaganda saying, "Get the measles shot," and that's your, that's what you should do. And that's not what we need right now. We need, people are not stupid. We have so much information that you can't hide the information. It's out there, but let's dispel the rumors and give us the facts.
Yeah. RFK, though, has a track record of knowing the toxic risks. He knows the data. He's been saying for years and years and years, these are harmful. And he showed the moms who were coming to him talking about my child went into autism, or I mean they just slid into, so he understands. I think he is one of us. I know I trust him. So
Well,
I really hope this transparency comes. Go ahead.
I mean, I guess I'd say we can only take it at face value what he communicates to the public. There's all these theories that, oh, well, he's just, this is 5D chess. This is, he's just warming up to things. And in my opinion, we just have to take what he says at face value. None of us are privy to what's going on behind closed doors. And so I'm keeping my foot on the pedal. I'm, you know, I'm going to pressure him. These keepers work for the people, right? And so I'm not going to self-censor because I'm predicting what might happen. I'm just going to take what he says at face value.
That's right. That's what I love about you, Mary. You don't self-censor. And that's what I respect that. And I hope that we do that here on this podcast as well. All right, let's talk about the states. You mentioned Casey DeSantis in Florida. Florida is calling for the end of the recommendations for COVID injections for children, banning mRNA mandates, and adding vaccine status to the Patient Bill of Rights. Given that we now have a federal government administration that is supportive of medical freedom and hopefully transparency and hopefully informed consent, how successful do you think states will be in fortifying medical rights over the next 4 years?
Well, unfortunately, it's still an uphill battle. I don't know if you're familiar with the situation in Ohio. They've been trying to pass a patient's, informed consent bill, and it keeps, it's been a struggle, which is surprising to me. Um, this, I just think we've got the pharmaceutical companies have a lot of power, a lot of influence. We have a hospital system, a lot of power, a lot of influence. We are up against gigantic forces, and it's grassroots leading the other side, and it is a monumental fight. So, do we need more people to speak up and do what they can? And it can just be emails or calls, or even just post on X where you can tag the elected officials if they're on X and not hiding. But it's a huge battle,
Yes.
and I didn't real I'm seeing it. I'm seeing how. So, for example, in Iowa yesterday, or Monday, there was a hearing, a subcommittee hearing about a new bill, SF 360, that will ban the mRNA or any kind of gene-based vaccine in Iowa. And it passed the subcommittee. And yesterday, it went to the Senate Health and Human Services Committee, but the chair of that committee just decided they wouldn't vote on it, just left it off the docket. And so the bill just dies. And it's just very frustrating. It's the battle is huge.
We understand grassroots efforts as we are grassroots, and it is exhausting. Um, Breaking the pharmaceutical hold, I guess the root of that is it American citizens realizing that the traditional methods are really perhaps not in their best interest. The traditional Western medicine, their interests are not at the heart of traditional Western medicine, and maybe it's taking health into their own hands and going to this this model that we talked about at the beginning of the podcast and taking care of themselves, like you said, with diet and exercise. And
Yeah, I've seen a lot of people come to me just to say, okay, I'm not going to take any medication that you might want to prescribe to me, but I just want to make sure I'm okay and not on the verge of death. So that's sort of a needs friend. It's like, okay, I'm going to get checked out, but I will not take any medication if you want to prescribe it, just to let you know. So that's,
yeah.
but I mean, I think that's the way to go. Honestly, if you can, like I said, keep your weight under control, exercise, manage your stress, get enough sleep, watch what you eat in terms of, natural products that don't have a lot of, nasty stuff in them. That is your best bet for staying away from doctors and out of the hospital.
Mhm. Mhm. How has the freedom fight affected you and your family?
Well, I have 4 boys and they're teenagers now. Um, I'm fortunate because when all this hit, they were at a school that was very supportive of me and like-minded. They never locked down. They never required masks. They certainly didn't would never require a kid to get a COVID shot. So that was super fortunate. So when everything was going really crazy and, I was scared to show my face at the grocery store or at sporting events, they were an environment that was on my side. So that I
Yes.
super thank and I'm gonna call them out. It's Western Academy in Houston, Texas. They're an amazing school. It's a Catholic school. It's for boys only, and all the teachers are male, and they don't have any electronics on the campus. And they allow them to climb trees and bring Nerf guns to school and ride their scooters and skateboards at school and play tackle football. They just really embrace boys, and it's just been an amazing school, and I'm very grateful.
Well, Mary, thank you so much for how you stood up and putting your career really on the line for this. How have you seen your career and your practice take off or not take off? I mean, what does that look like now because of speaking out so strongly?
Well, my practice has shifted, so it's not. I mean, I do see a lot of ear, nose, and throat issues, but now I see a lot of vaccine injuries. I see, people are trying to come to me for issues outside of ENT, which can be challenging just because I'm not a primary care doctor. But people are so fearful of the system that people coming to me that would normally not come to me because they just don't want to. They don't trust any other doctors, and that's a huge problem. Is that patients are scared to go to the hospital. They're scared to go to just any old doctor. And I think if our new administration doesn't fix that problem, it's not going to get better on its own. Um, and the first way to fix it is to not sweep everything under the rug, to actually come out and talk about what a disaster the pandemic was, what we could have done better, and acknowledge that these shots are harmful and pull them off the market.
How can the average American citizen fight back against corruption? And in this case, maybe the medical boards?
Well, we're fortunate in this digital age. You can reach a lot of people far and wide just by getting on your computer, um, becoming more active. You can follow the legislation. You can reach out to the people that represent you. You can get on social media and scream and shout and voice your opinions. It's actually, I don't know how people did it before. I mean, there's just so many ways to communicate now and to get your voice heard. Um, so I would say, maybe set a goal, spend 10 minutes a day reaching out to somebody who represents you or is in a position of power or has a bigger microphone than you, and let them know how you feel.
Mm. Well, that's excellent. Mary, thank you so much for joining me today. It's great to hear your story and kind of an update with you and to hear about the efforts of your organization and just to have you on our platform. What an honor.
Well, thanks so much for having me.
Thanks so much for tuning in. Please like, comment, subscribe to, and share our podcasts. I'll see you next week.